Hello everyone, I'm Chris Reese. I'm a nurse practitioner student with Maryville University. Today I'm going to go ahead and perform a head-to-toe assessment, and my volunteer is Corey. I would like for everyone to know before we get started that Corey has emptied his bladder. We had tested his far and near vision on the Snellen chart. His near vision is 20/20. We recorded his height and weight. We have gotten his vital signs, his heart rate, his respirations, his blood pressure, his temperature, and his O2 saturation, which was 100%. Corey has opted to go ahead and wear athletic shorts and go shirtless versus wearing a gown. So if it's okay with you, Corey, we're going to go ahead and get started. Okay, Corey, first I'm going to start by looking at your head, the circumference of your head, and the size and shape, and it is of normal size and shape for your stature. I'm going to look at your skin color, make sure that there's pink and no jaundice, and it is normal color for your ethnicity. I'm going to look at your eyes. Your eyes are symmetrical and in alignment. I'm going to check that your ears are in the appropriate place on your head, and the tips of your ears are in line with the inner canthus of your eyes. I don't see any tremors or facial movements or drooping, indicating cranial nerve number 7. The facial nerve is intact. If it's okay with you, we're going to go ahead and start the palpation phase of the skull and head. I'm going to palpate for any lesions, bumps, or masses. I don't feel any. I'm also going to palpate the hairline and look for any type of alopecia, any type of dandruff or dermatitis, or any type of parasites. And I do not see anything at this time. I'm going to go ahead and also palpate your facial bones. I notice that your facial bones are intact. I'm going to go ahead and ask if you have any pain in your frontal sinuses.
No.
Your maxillary sinuses?
No.
Okay. I'm going to go ahead and ask you to open your mouth and clench your teeth. Smile. Frown. Blow out your cheeks. I want you to go ahead and close your eyes tightly. And wrinkle your forehead. And stick out your tongue. This test indicates cranial nerve number 9, the glossopharyngeal, cranial nerve number 7, the facial nerve is intact. I'm also going ahead and palpate your jaw for any tenderness. Can you go ahead and open your jaw for me? Can you close it? Can you move it from side to side? Do you hear any clicking or feel any pain in that area?
No.
That indicates the temporomandibular joint is intact. I'm also going to go ahead and test your sensation, cranial nerve number 7, the facial nerve, while I'm here. So if you would, go ahead and close your eyes and tell me where I touch you with this cotton ball.
Forehead, nose, chin, right cheek, left cheek.
Cranial nerve number 7, the facial nerve appears to be intact. I'm going to go ahead and move on to the eye examination. I'm going to look at the eyebrows. I'm going to notice that the hair on the eyebrows is evenly distributed. Can you close your eyes for me? I'm going to look at your eyelids and notice that there is not any lesions or masses or crustaceans. I'm going to look at your eyelashes. They are evenly distributed and intact, and you can open your eyes. I'm going to check your lacrimal apparatus. Feel any crustaceans or drainage? Do you feel any pain in this area?
No.
Your lacrimal apparatus appears to be intact. I'm going to look at your eyes. Look at your conjunctiva. It is pink and moist. I'm going to look at your sclera. It is white with small red capillaries. They are not yellow or jaundice, which would indicate a normal finding. At this time, I'm going to go ahead and check your pupillary responses, cranial nerve number 3, your oculomotor nerve. I'm going to go ahead and shine a light. And your pupils are equally reactive to light at 3 to 4 millimeters. I'm also going to ask you to follow this pin to your nose. And your eyes are known to converge normally. I'm going to check your 6 cardinal fields of gaze. I'm going to ask you to follow this pin without moving your head, Corey. Follow it with your eyes. All right. His eyes have moved correctly with the 6 cardinal fields of gaze, indicating cranial nerve number 3, the ocular motor, cranial nerve number 6, the trochlear, and cranial nerve number cranial nerve number 4, the trochlear, and cranial nerve number 6, the abducens nerve, are all intact. I'm going to perform the cover and uncover test. Corey, I want you to cover your eye, one eye, and look at an object in the distance, and look back at me, and do the same for the other eye. Look at an object in the distance, and look back at me. And I would note that your eyes constrict normally. Again, noting that cranial nerve number 3, the oculomotor nerve, is intact. I would also, at this time, go ahead and check the red reflex. I would do that by turning off the light and shining the ophthalmoscope in the eye and looking at the retina. Should appear to be red, and that would be a normal finding. I would look bilaterally. After this, we're going to go ahead and move on to the ear examination. I'm going to look at the auricle of the ear and make sure that it is elastic and snaps back into place. I'm going to pull the lobule forward and look behind the ear for any type of scaling, or any type of rashes. It appears to be intact. I have performed the auditory examination of Corey's bilateral ears. I've done this by using the otoscope and looking in the ears. My findings were the canals were pink and moist. There was no foreign bodies or drainage. The tympanic membrane was intact and pearly gray. There was a little cerumen, and this was done bilaterally, and these are all considered to be normal findings. I would also checked for interrupted light reflex, and it was at 7 o'clock on the left ear and 5 o'clock on the right ear. Next, Corey, I'm going to go behind you and perform the whisper test. I want you to go ahead and whisper, or I want you to go ahead and repeat what I whisper in your ears, okay?
Cat. Hello.
All right. This tests cranial nerve number 8, the vestibulocochlear, or the auditory nerve, and it appears to be intact. I'm going to go ahead and do the Weber test on Corey. I would do this by using the tuning fork. I would hit it on my hand, place the tuning fork in the center of his head, and ask him to tell me when the sound, if he hears the sound equally in both ears.
Yes.
Indicates a normal finding and indicates that he has good bone conduction. Next, I would go ahead and perform the Rhine test. I would do this bilaterally also. I would hit the tuning fork on my hand. I would place it on his mastoid bone and ask him to tell me when the sound disappears.
No.
I would go ahead and move it to 4 to 5 centimeters in front of his ear and ask him again to tell me when the sound disappears.
No.
That is a normal finding. That indicates that he has good air conduction. I'm going to go ahead and move on to the nose portion of the study. The assessment. I'm going to note that Corey's nose is symmetrical. It is midline. It sits evenly on his face. I'm going to palpate around the nose and nasal sinuses and do you feel any tenderness there?
No.
I'm going to ask Corey to tilt his head back. I'm going to look at the turbinates and make sure they are pink and moist. They are not enlarged. They're not swollen. Don't have any drainage. He also has no polyps. His septal was midline, and no types of drainage indicating some type of sinus infection. At this point, I would also check for patency. Corey, I want you to go ahead and cover one nostril. Go ahead and breathe in and do the same. Repeat the same with the opposite eye. Go ahead and breathe in. And he indicates that his nares are patent. I'm going to go ahead and move on to the oral aspect of our assessment. I'm going to inspect Corey's oral cavity. I'm going to note and put on some gloves, and I'm going to note that his lips are pink and moist. There's no signs of cracking or any types of lesions. I'm going to go ahead and look at his inner lips, make sure they're pink and moist. I'm going to look at his gums, make sure there's no signs of gingival hyperplasia or recession. Corey, if you would open your mouth for me, I would note that all of his teeth are in alignment. There is no missing teeth, and his teeth are smooth and white. Corey, can you stick out your tongue for me? I'm going to ask you to move. I'm going to move your tongue from side to side, noting that it is freely movable. I'm going to go ahead and use the tongue depressor. I'm going to ask Corey to open his mouth. I'm going to look under your tongue. I don't see any type of lesions or masses or anything else that could hide there. I would look at your tongue also, making sure that it is pink and moist, the same as under your tongue. And there's no lesions or masses. It's symmetrical. I'm going to look at your oral or buccal mucosa and ensure that it is pink and moist and no lesions or ulcerations. Corey, if you would go ahead and open your mouth and tilt your head back, stick your tongue out. I'm going to go ahead and inspect his anterior-posterior pillars, including his tonsils. His tonsils are pink and they are not enlarged. His uvula is midline. Corey, can you say ah? His uvula has a symmetrical rise and fall, or even rise and fall. And his posterior pharynx is also in place. Corey, I'm going to go ahead and check your roof of your mouth and note that your hard and soft palate is also intact. At this point, I would also go ahead and perform the gag reflex test on him, and if normal, which it was, he would have a gag reflex present, which would test the cranial nerves number 9 and 10, the glossopharyngeal and the vagus nerves. Moving on, I'm going to remove my gloves. And we're going to go ahead and move on to the neck inspection. First of all, I'm going to go ahead and test your range of motion. Go ahead and tilt your head forward, tilt your head backward, turn your head side to side. Also going to check for resistance against my hand. Go ahead and check resistance against my hand. He has good neck strength. I'm going to note the appearance of his neck. It is supple and smooth. I don't see any lesions or masses. The hair is evenly distributed. Can you swallow for me? He has even rise and fall of the trachea. I don't see any type of enlarged goiter or thyroid gland indicating a goiter, and I also do not see any visible jugular vein distension. I'm going to go ahead and palpate the lymph nodes. I'm going to go palpate his preauricular, his postauricular, his tonsillar, his submandibular, his submental, his anterior cervical chain, his posterior cervical chain, his occipital lymph nodes, his deep cervical lymph nodes, and his supraclavicular lymph nodes. I don't feel any lesions, bumps, or enlarged lymph nodes, indicating there is no type of abnormality there. I'm also going to palpate his carotid arteries one at a time for any bruits or thrills. I do not feel any. I'm also going to palpate his thyroid gland for any type of lesions or masses, and it all appears to be normal. And I'm also going to go ahead and listen to his carotid arteries and his thyroid gland for any type of bruits or thrills. And none appear to be present. I'm next going to move on to the upper extremity portion of our examination. I'm going to feel his shoulders. Do you feel any pain or tenderness in your shoulders, Corey? I want you to feel the skin and note that it is warm and dry. The hair is evenly distributed. I see small areas of hyperpigmentation or freckles. I also note that he has adequate brachial pulses and radial pulses. Also notice that he does have a small scab on the left elbow, indicating that it is in the healing phase. It does look normal and there's no signs of infection. I'm going to go ahead and turn your hands over. I'm going to inspect your hands. I'm going to note that there is no type of abnormalities or discolorations. All your knuckles appear to be intact. I'm going to look at your fingernails, make sure there's no abnormal convex curvature or clubbing. I'm also going to test your capillary refill, which is brisk in less than 3 seconds. You can go ahead and put your arms down. I'm going to go ahead and move on to the posterior aspect of the chest. I'm going to first start by looking at the skin on the back and look for any type of lesions or masses. I'm going to also inspect for any abnormalities. I'm look like a winged scapulas. I'm going to inspect for any surgical scars. His thoracic configuration is midline, which would be a normal finding. I'm going to go ahead and percuss his costovertebral angle bilaterally, listening for any type of dullness or hyperresonance. I would also go ahead and percuss his diaphragmatic excursion. Corey, go ahead and take a big deep breath in for me and let it out. Go ahead and percuss. Now go ahead and take a big deep breath in for me and hold it. There seems to be a 3 to 4 millimeter variance, which would be normal finding for his size and stature. Also repeat this on the opposite side. After this, I would go ahead and also make sure his diaphragm expands symmetrically. Go ahead and take a big deep breath in for me and let it out. His diaphragmatic expansion is regular and level, normal finding. I would go ahead and next go ahead and palpate for fremitus. Corey, I want you to say 99,
99,
99,
99,
99.
99.
I don't feel any abnormal vibrations or fremitus. I would also next go ahead and palpate or percuss his posterior chest and lateral chest walls. I would do this systematically and side by side. Can you raise your arms? Listening for any type of hyperresonance or any type of dullness. I would then, lastly, go ahead and auscultate all areas of the posterior chest, laterally and side to posterior chest, systematically and side to side. Also would auscultate lateral chest. Go ahead and take a big deep breath in and let it out. In, 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 and let it out. I'm going to go ahead and move around to the anterior chest. Do you feel any type of pain or tenderness in your shoulders areas,
No.
your chest area? I'm going to test your cranial nerve number 11, your spinal accessory nerve. Can you go ahead and shrug your shoulders against resistance? And spinal accessory nerve, cranial nerve number 11 appears to be intact. I'm also going to go ahead and palpate the infraclavicular and the axillary lymph nodes. I don't feel any type of enlargement or masses. I'm also would next inspect the appearance of his chest. I would note his respiratory rate and effort is symmetrical, it's unlabored. I'm going to go ahead and note that his skin is intact, his hair is evenly distributed, and there's even rise and fall of the chest. And go ahead and check for expansion. Go ahead and take a big deep breath in for me and let it out. There appears to be even a diaphragmatic expansion. I'm going to go ahead and text for tactile fremitus. Go ahead and say 99, Corey.
99,
99,
99,
and 99.
99.
Palpating for any type of abnormal vibrations or fremitus. Next, I would go ahead and inspect the precordium for any type of bruits, thrills, or heaves or pulsations. I don't appear to see any. I would go ahead and palpate the precordium, and it is regular. There is no bruits, thrills, or heaves or abnormal pulsations. And I will go ahead and also inspect the palpate the apical pulse. It is between the 4th and 5th metacostal space, mid-clavicular line. I'm going to go ahead and put my hand here and feel for his apical pulse, which appears to be regular. After this, I would go ahead and palpate and percuss his anterior and lateral chest walls systematically and side to side. Listening for any abnormal dullness or hyperresonance. After this, I would go ahead and listen to Corey's anterior and lateral chest wall. Go ahead and take a big deep breath in for me. Let it out. Again. 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 Let it out. And again. Let it out. And also we go laterally. In. Let it out. In. Let it out. In. Let it out. In. And let it out. Noting that I've done this systematically side to side, all lung fields appear to be clear, no abnormal signs of wheezing, rales, or rhonchi. Next, I'm going to go ahead and auscultate his heart sounds. I'm going to go ahead and auscultate the aortic. Could you lower your hands for me, Corey? The aortic, the pulmonic, Erb's point, the tricuspid valve, and the mitral valve. All appear to be normal with no murmurs or gallops, and normal S1, S2. From here, we're going to move to your abdomen. I would like for you to, Corey, go ahead and lay back on the bed. I'm going to go ahead and ask you to raise your head to a 45-degree angle. I'm going to look for inspect for any type of pulsations, abnormal pulsations. I'm also going to look for any type of weakness in the abdominal muscles, indicating a possible ventral hernia. So you can go ahead and lay back. Those appear to be normal. I'm going to go ahead and inspect for any abnormal waves or motions of the abdominal area. Then going to go ahead and percuss the splenic and liver borders, listening for any abnormal dullness and or hyperresonance, and it all appears to be intact and normal. I'm going to go ahead and auscultate. I'm going to go ahead and auscultate your bowel sounds and your pulses in your abdomen region. So I'm going to go ahead and auscultate the ascending colon, the transverse colon, the descending colon, and over the sigmoid colon. I auscultated, and I appear to have found some hypoactive bowel sounds, which would be normal for Corey. I'm also going to go ahead and auscultate over the aortic and pulse, renal, iliac, and femoral pulses. So auscultating over the aortic, the bilateral renals, the bilateral iliacs, and the bilateral femoral pulses. Noting any abnormalities or bruits or thrills. That appears to all be intact and regular. I'm going to go ahead and also lightly palpate the abdominal area. Do you feel any tenderness, Corey?
No.
And that all appears to be intact. If you would, go ahead and sit up for me. I'm going to go ahead and inspect the posterior region of your abdomen. I'm going to palpate over the left splenic and the right right liver borders, feeling for any abnormalities. Also going to palpate over the right and left kidneys, feeling for any lumps, lesions, or masses. Those all appear to be intact. Next, I'm going to go ahead and move to the lower extremities. I'm going to note the his thigh muscles are well developed and of even distribution. I'm going to go ahead and palpate the temperature and note that it is warm to touch. I'm going to note that the hair is evenly distributed. I'm going to go ahead and move down to his lower extremities and feel for any type of edema in the lower extremities. I'm also going to feel for the dorsalis pedis pulses, the posterior tibial pulses, and the popliteal pulses, feeling for any type of abnormal bruise or thrills, which I do not feel at this time. We'd also noted that we would like to look at his neural exam, and I would like to note that I have tested many cranial nerves throughout this examination, and all cranial nerves appear to be intact. He also had normal sensation. I'm going to go ahead and check the musculoskeletal system. So Corey, if you would go ahead and pull against my hands. Go ahead and push against my hands. He appears to have adequate symmetrical upper body strength. I would go ahead and take my tuning fork and I would test the brachial reflexes. I would test the patellar reflexes. And I would test the Achilles reflexes. And all appear to be a normal finding. Corey, if you would, go ahead and stand for me. I want you to face the camera. I want you to bend over at the waist. I want to note that your neck and your head and your spinal column all appear to be midline with no evidence of kyphosis or scoliosis. You can go ahead and stand up for me. I want you to put your arms out in front of me. I want you to stand with your feet hip width apart. I want you to go ahead and flex your knees and stand back up. He has normal flexion at the knee and the hip area. If you would go ahead and have a seat. At this time, I would like to ask Corey, do you have any questions regarding this assessment?
No.
Do you have any, we're going to go ahead and discuss the findings. I'm sorry. We're going to go ahead and discuss the findings. And this concludes our head-to-toe assessment on Corey. Thank you and have a good day.